Hi, I'm Dr. Lindsey Tavakolian. I'm a plastic surgeon, and I want to explain to you what happens to our bodies after significant weight loss. So, if you have taken Ozempic and you've had great success with weight loss, and you find yourself with some body changes after that weight loss, I want to help explain to you what these are and why they've happened. So, the analogy that I like to use is that your skin is born with a Spanx like material in it. So, you're born with elastin and collagen. These are the strength and the stretch components of your skin. And when you're young, the Spanx is really strong. Well, as you age, you lose collagen and elastin just from aging itself. This increases with sun exposure and then also specifically with weight gain and weight loss. So when you have significant weight gain, you're stretching out that Spanx in your skin. And you can even stretch it to the point where it breaks. This is when you get stretch marks. And then, if you have success with weight loss and you shrink your underlying frame back down, but you still have this skin that has broken Spanx in it, the Spanx will not retract with your body to re-drape and contour over your frame that's now smaller. So, this is why oftentimes after significant weight gain and weight loss, people need plastic surgery in order to excise the extra skin and folds that come from significant weight gain and weight loss. There are really five main ways that the body changes. And the first one is you will have loose and sagging skin, especially with rapid weight loss. You will probably experience skin excess in the areas where you lost the bulk of the most weight. So it depends on where you carry your weight, but this could be in the tummy, it could be in the buttock, it could be in the thighs, in the face, and all of this can lead to extra skin that there's no fix for except to excise some of that extra skin with body contouring or facelift procedures. Second, the formation of stretch marks. Anytime that there is a rapid change in weight, stretch marks often form. And this is from the breaking of those collagen and elastin fibers in your skin. The areas where you have stretch marks will actually have a harder time healing after surgery. And so, if you have a really heavy burden of stretch marks in your skin, you can expect to have difficulty healing with surgical procedures where those stretch marks are, which just means you need to go above and beyond on your part to take in a lot of protein and do everything you can to set yourself up for good healing. Third, fine lines and wrinkles. So losing that fat behind the skin, that's the support system that your skin sits on, will deflate. And when it deflates, you'll see fine lines and wrinkles in your skin, much like a deflated balloon. Now you're not going to see this plumped up, perfect contour balloon. You're going to see wrinkles and fine lines where there used to be volume underneath. 4, skin irritation and rashes. So with this excess skin comes oftentimes folds of that skin on top of itself, and this often happens in the stomach area, beneath your stomach fold of skin, or underneath your breasts, or in other areas where there's creases in your body. When you have these skin folds, oftentimes it can create irritation, and it is not uncommon to have chafing or heat-related rashes in those areas. And then 5th, changes in skin texture. So when you think of a really tight Spanx garment, sorry, this may be lost on my male community, but for women, I think you're probably familiar with how a Spanx garment looks once it's been stretched out too much or broken. And when that Spanx is smooth and really nice and really tight, the garment overall has a really nice smooth contour. Well, when you break those structural fibers of support and elasticity, you have ripples, you have breaks, there's irregularity. The same goes for your skin. When you lose collagen and elastin, and when you overinflate it from weight gain and then you deflate it with weight loss, when you break these features, you have a contour that is less than desirable. The only solution to that is to cut out the neighboring excess skin and then pull the skin that you do have nice and tight over the underlying surface in order to smooth it out and help that appearance. Now, the other things that we can do to help your skin texture is to regularly protect it from UV rays. So use your SPF, and also make sure that you're taking in adequate protein so that you can actually build up collagen and elastin in your body and have those building blocks to do so. I require all of my patients who are undergoing body contouring procedures to count their protein and supplement their protein 4 weeks before surgery and 4 weeks after surgery to optimize their healing and give them the best shot at having a fantastic outcome. As always, if you have any questions, please leave them in my comments and I will do my very best to answer them.